Hey everyone, welcome to, hi, hey everyone, welcome to Making It on Monday. I am pretty excited to talk to you today because when I was writing this topic, which is all about acupuncture and fertility, it's called, what's the point? Acupuncture and fertility. But when I was writing this topic, I realized this is something I've presented on a lot, but mainly to doctors and mainly to nurses and mainly at conferences. And I'm not sure how much I presented on this to patients. So I'm really excited to be here today. And if you're around, please say hello. If you're watching the live stream back, please make some comments and let us know if you've got any questions along the way, because we're more than happy to help answer any questions or queries you've got, okay? But yeah, if you are here, please say hello and we will get started. So today it's all about acupuncture, which is of course something at the Acupuncture Pregnancy Clinic we do a lot of, as you can imagine. So it's all about acupuncture. So what is the point of acupuncture when you're trying to conceive? And we're going to talk about, like, does it help? What's the history of acupuncture? We're also going to be talking about, what is the point in terms of in terms of the research. So does the research really highlight in terms of what acupuncture might be helpful with? And then we're going to talk about the points we use and when we recommend to come in and why we use them. So it's a real kind of a deep dive into acupuncture and the use of that for fertility today. And at the end, I'm going to give you the 5 reasons why acupuncture might help you conceive. Okay, cool. So for those of you, if you haven't tuned in before, my name is Amy and I am an acupuncturist, and I've been an acupuncturist since about 2008, and I've always been working in this kind of fertility IVF space because I love it. I'm also a researcher and an educator in this area of acupuncture, fertility, and all things integrative medicine. So that's enough about me. Let's get into it. Okay, so the first thing we're going to talk about today is acupuncture and can it help? So you probably know that Chinese medicine has been around for a pretty long time. In fact, it's been around for about 3,000, some people say 4,000 years. And actually about 3,000 years ago is when we first started seeing Chinese medicine texts that specifically started to talk about gynecology and obstetrics. And they're talking more in relation to herbal medicine. But just to give you an idea about how in-depth kind of Chinese medicine is and how comprehensive it is and how it's developed over time, I want to tell you just a tiny bit about this. So if we then fast forward from 15 BC and we fast forward to about almost 1,600 to 1,000 AD, then we're looking at Chinese medicine texts, and these were enormous. They were comprehensive. One of the Chinese medicine texts that was used quite widely, it had about 10 volumes just on obstetrics and gynecology. And of that, there was about 283 conditions, gynecological and obstetric conditions that were described. So this is around 600 AD. The text had 7 volumes and it was just enormous. And so today's modern Chinese medicine practitioner, when they're looking at your fertility, they get handed down these texts as a wealth of knowledge. So there's so much information and there's so much value of Chinese medicine that we are so lucky to have access to. And then acupuncture, so this is what this is all about. Acupuncture started being developed and being a part of Chinese medicine treatments around about 100 AD, so a little bit before. And it has then kind of developed into a very kind of comprehensive, very systematic approach since. And so today we're talking about acupuncture, and we're talking about how specifically acupuncture is used to help with fertility. And we know that Chinese medicine is very holistic, so we're always going to be taking your pulse, looking at your tongue, and we're going to be looking at what's out of balance with it for you. But today I'm going to be talking more about just the specific mechanisms of acupuncture surrounding how it helps improve fertility and how it improves chances of conceiving. And so while we're going to be always taking your individual constitution and what you present with into account when we're doing a treatment, and we're always going to be treating that, there are specific points that have specific functions and mechanisms that pertain to fertility. So we're going to be talking a little bit about the research around those. All right, so first, can it help, and the history. I think according to the history, I think acupuncture probably can help. It's been around a really long time if we're just looking at that. And from a Chinese medicine perspective, the amount of text and things you need to read when you're studying to be a Chinese medicine practitioner about the use of acupuncture for fertility, it's enormous. So I just wanted to begin with a historical context. But now there's more of an evidence base now, which really backs Chinese medicine and backs acupuncture and the use of it for women's health conditions and also fertility. And so some of the research suggests that some of the mechanisms that are involved are things like that acupuncture will help increase the production of new blood vessels. Hi Liz, thanks for joining. Yeah, say hi if you're on. Love to say hi. Otherwise, I feel a little bit all alone. I can see there's a few people on now, which is awesome. Anyway, sorry, let's get back to it. Acupuncture. So the research suggests that the use of acupuncture helps promote blood flow and angiogenesis, which is it helps increase the promotion of new blood vessels to increase blood circulation. And why this is really important is when we do this acupuncture around like the ovaries and places like that, that can really help improve the nutrition and the oxygenation of the blood flow to these areas and really improve and help nourish the follicles and nourish the ovaries and nourish the uterus. So that's number one, that the research suggests what acupuncture can do in terms of fertility. Another thing it suggests is that it has an effect on the pituitary gland, which I'm not sure how familiar you are with the pituitary gland, but it has a really big effect on how all of our hormones in our body, particularly our sex hormones, how they run in our body. So acupuncture has been shown in the research to have an effect on the pituitary gland and also improve ovarian response. And this is particularly important for people who are undergoing IVF, because we know that we want to improve the ovarian response because we're trying to get multiple follicles, multiple eggs, and that acupuncture may have a role in helping improve your ovarian response to hormonal stimulation. The third thing it does is improve ATP production. And again, I'm getting a bit sciencey, jargony, but ATP is basically the energy in your body. ATP has a role also in helping with the mitochondria, which helps a healthy cell function. So basically improving ATP production improves mitochondria, which is particularly important for those very big cells, those egg cells, in order for them to function really well. And so we're getting healthier cells, which means we're probably getting healthier eggs. Now, the other thing that acupuncture has been shown to do, according to the research, is also inhibit the central nervous system. The sympathetic nervous system. And the reason why this is important is that it can help with your stress response, but it also can help improve vasodilation, so improve blood flow to the ovaries and the uterus. And then probably not thirdly, I think we're up to fourthly, the blood flow, the stress response is also helped mitigated by a whole cascade of different responses that acupuncture does. So it can increase the endogenous opioids and endorphins and things like serotonin, which help create relaxation, and they help mitigate like a stress response. And I find this is particularly really one of the things that people say to us time and time again when they come into the clinic is that either if they've been trying to conceive naturally or trying to conceive through IVF, that they're finding that they're coping a lot better, they're less anxious, and they're feeling a lot better in themselves and feeling more relaxed, which is awesome. We love that. We love that so much. So In terms of, what the point is in terms of research, in terms of natural fertility, there's research that suggests, with one study, that when a woman would come in 8 times, this showed an increased blood flow to the ovaries and the uterus. And then when they did a follow-up appointment, it showed 4 weeks later, after the treatment had stopped, it showed that there was still an increased improvement. So sometimes people come in and they are really excited to get started with acupuncture, and then something happens, like they might go on holidays, or something happens and they need to take a break. But I think this research is really kind of reassuring that even if you've done some acupuncture in the past, it can be really beneficial for you in the future. And Electro Acupuncture, which we use often in this clinic, is where we just put a tiny little clips on the needles, and it just promotes just a tiny little kind of a flicker, a buzz sensation on the needle, and that just really activates the needle and helps stimulate it more and increase better blood flow to the area. And we often use this with patients in the follicular phase, so from when the period ends to when ovulation occurs, so during that phase. And we'll often do it in points over the ovaries and over the uterus. And the reason why we do this, and another point that helps stimulate estrogen, and the reason why we do this is because it's really good at helping promote not only juicing up the hormones, but also increasing lots of blood flow. And the research has suggested that both the structure and the quality of the endometrium is better after electroacupuncture treatment. That research was after 16 sessions. But it just shows that acupuncture can be really helpful in a whole different varied ways and amounts, depending on what you're looking at. Okay, so then we're going to go into a bit of research around IVF acupuncture. And IVF acupuncture kind of first started around the Paulus protocol in the early kind of 2000s. In 2002, Paulus came out with this study which showed having acupuncture both before your embryo transfer and after, on the same day, it really improved the clinical pregnancy rates. And back then, we're talking like almost 20 years ago, the pregnancy rates with IVF were a little bit lower than what they are now, not massively, but a little bit lower. But it showed that there was about 42% of women would conceive versus 26% when they had acupuncture both before and after embryo transfer. Since 2002, there's been a lot of research done on IVF acupuncture, and particularly focused around that embryo transfer acupuncture. And what they've come up with is that potentially that they're not 100% sure whether this has a significant effect. So some of the studies had sham acupuncture, and someone would be pretending to do acupuncture on the patient using sham needles. And when they compared them to these sham needles, the effect, they weren't sure if it was really increasing the clinical pregnancy rate. However, if they just compared it to a control, which was just someone undergoing IVF treatment, and they weren't having any acupuncture, it did show an improvement. So now we're not, whether or not to get the pre and post embryo transfer is something that we don't necessarily recommend to all patients, but we know from the latest meta-analysis that there's some groups that when they looked in 2019, when they looked at some groups of women, they found whether or not we compared them to the sham or we compared them to just like a control group, which is just people going through IVF, this group of women always did better with just doing a pre and post embryo transfer. And so some of the characteristics of this group were women who had particularly poor baseline pregnancy rates. So women who they had maybe multiple cycles or been trying to conceive for a really long time and they still hadn't fallen pregnant. So these women had a significant improvement in terms of their clinical pregnancy rates when they did a pre and a post embryo transfer. The other kind of group of women that did really well in terms of having a statistically significant improvement in their clinical pregnancy rates were women who were highly anxious and had high stress levels. And I'm going to talk a little bit more about the effect of acupuncture on stress levels. So yeah, stay tuned. So if you are undergoing IVF, this is one of the considerations if you're trying to decide whether or not to do embryo transfer acupuncture. However, the meta-analysis also showed that I talked about in 2019, and it reviewed all the research, so back from the days of Paulus in 2002. And what it found when it looked at all the research, it found that actually the studies where they did more than 3 acupuncture sessions, that was a significant modifier in terms of clinical pregnancy rates. So women who had more than 3 acupuncture sessions during their stimulated cycle and over their IVF cycle were much more likely to have a more significant, had a significant improvement in their clinical pregnancy rates. So at the Acupuncture Pregnancy Clinic, that's something we tell people when they first call us up if they're in the middle of a cycle. We'll try and see them maybe once or twice at a minimum before they come in for, perhaps they're going to come in for the embryo transfer acupuncture as well. So that's one consideration. However, what it did show is that dose was really important, and the higher the dose of acupuncture there was an increasing rate of clinical pregnancies. In one particular study, Hollander, in 2015, she looked at over 1,000 women, and the women she found who had done acupuncture, and they'd done quite a high dose, so they'd done about 12 acupuncture sessions, and I'm going to break down to you what that would look like if you're coming in to an acupuncture clinic, like how often you come in. So they'd done about 12 acupuncture sessions, and that was both prior starting IVF and then during their IVF cycle. And what they found with these women is that they had a much higher live birth rate. And I do actually need to add in here that they were not only just doing acupuncture, but they're also doing Chinese medicine, what they call a whole systems approach. So they weren't just doing these protocol points, they were also treating the whole person. They're also prescribing herbal medicine if that was appropriate, and prescribing supplements. So it was kind of mirroring what would normally happen in an acupuncture clinic anyway, because we're normally treating the whole person, and we're normally prescribing herbs and supplements where appropriate. So this study, the Hollander study, found that there was a 61% increase in terms of live birth rate with the group who did the whole systems Chinese medicine, which was a significant improvement. And that's why at our clinic, at the Acupuncture Pregnancy Clinic, that's what we really try and mirror. We'll often be prescribing herbs and supplements according to what is appropriate for the patient, but also we'll be trying to recommend a high dose acupuncture. And since this research came out, I've been, using more of this high dose acupuncture because I think there's evidence to suggest and support, this recommendation. And I've definitely found that our patients' outcomes have been significantly improved since then, I feel. So what we normally recommend in terms of when patients come in is that they do come in a month at a minimum. If they're doing IVF, trying to come in about a month before, and that if they come in twice a week for 1 month before, then that gets you up to about 8 sessions, and then the 2 weeks during the stim cycle. So that's kind of getting the 12 sessions. But I'm going to talk more about that right at the end. But for now, I also want to talk to you about the other really juicy fact about acupuncture and how it helps reduce stress levels. So I talked about before how it helps with the parasympathetic nervous system and sympathetic nervous system. And it also helps with the heart rate variability. And so it helps reduce that, as well as all the feel-good kind of chemicals, such as T cells, cytokines, opioids, endogenous opioids, endorphins, enkephalines, serotonin. It also helps to reduce your cortisol levels. And all these things act to help regulate the physical and emotional kind of aspects of stress in your body. So having acupuncture not only could have a physiological benefit, but a really big psychological benefit, which I feel is very important to note, because people undergoing IVF treatments or fertility treatments in general have been studied, and it shows that their stress levels and the psychological impact is around about the same as people undergoing cancer treatment. So it's just absolutely huge. So anything we can do to help and support our patients, to help, you know, keep calm, not feel anxious, and also if they need to, you know, continue their treatment. And for some people, it's not a short journey. Then they feel like that, you know, they've got the emotional resilience to do that. So that's where I see, like, you know, acupuncture having a really big role to play. So, you know, according to the research which I've talked about, like the Hollander research, we feel like that is, you know, often really like the gold standard. So as I said before, that was often about 12 sessions. And most people undergoing IVF, they don't want to wait too long before they begin. And so while we'd love to see you about 3 months before you start, for some people that's just not really an option, and they're not willing to wait that long before they commence their IVF treatment. And of course, while I'm giving these recommendations, I just want to really add a note. We'll just meet you wherever you're up to and help support you. And I feel, you know, while acupuncture is like medicine, so the higher the dose you take, the more impact you get, I feel every session also can be incredibly transformative and, you know, can be very healing and can make a really big impact on people. So because of the Hollander research, we really suggest that people come in, you know, twice a week for the month before they commence their IVF cycle, and then twice a week during the stimulation phase. And then we'll usually see them before and after embryo transfer if they want, if they feel they're in a part of that subgroup who would benefit, or and if they want to do it. But really, I feel the the pre and post embryo transfer, it's really just the icing on the cake, where we can see from the research we get the really big benefit from is doing that pre-work, and that's because of all the things we've mentioned before. I'm noticing the time, so I'm going to try and keep this finishing up. So we also offer laser acupuncture, and what laser acupuncture is it is a low-level light laser, so it's a cold laser, and it basically, the photons help stimulate the cells to improve and increase the ATP, which helps improve mitochondria function. So we often use this with patients. It's quite a safe, technique that we use, as well as electro acupuncture, which I've talked about before. Electro acupuncture can be fantastic because we know it helps just improve more blood flow to the area, and in particular can help increase the structure and also the quality of the endometrial lining, which is where, you know, an embryo would implant. So whether you're trying to conceive naturally or trying to conceive with IVF, all of these things, these are all, you know, really good reasons why acupuncture may help. The meta-analysis also, which I talked about earlier, it also suggests that, you know, just having more than 3 sessions can really improve your clinical pregnancy rates. And so that's something to keep in mind if you're wanting to do acupuncture but you don't think you can do the high dose, that there really is a positive effect with the three doses. And if we're just doing fertility acupuncture, usually what we would do is see the patient just twice a week, from when they get their period to when they ovulate, so in the follicular phase, and then just once a week after that to help with their fertility. Okay, so what are the 5 reasons that might be really helpful to have acupuncture if you're trying to conceive? What is the point? So I'd say that number 1, it feels really good. And when people are trying to conceive, there's not that many people who, after a while trying to conceive, they're not starting to feel kind of some psychological impact and starting to feel stress. So acupuncture, for all the reasons we've talked about, is really great at helping people cope a little bit better, manage stress, which is fantastic for people's resilience, and also just their well-being, to be able to kind of keep living life and feeling good even when you're trying to conceive, which can be a really tricky time for some people. The second thing is because it helps with menstrual regularity. So if you have an irregular cycle, or if you're just wanting to augment and improve your natural cycle, or you're doing an IVF cycle and you want to improve your hormonal response, And these are some of the things that acupuncture may be able to help with. Number 3, acupuncture can help improve the blood flow to the ovaries and to the uterus, especially when we use electro acupuncture. And number 4 is something we've talked about before, but it can also improve the endogenous, so the internal production of your hormones, and help if you're trying to conceive during IVF. It may have a positive impact in terms of your hormonal response. And number 5, at the right dose, research suggests that acupuncture, a whole systems approach of acupuncture and Chinese medicine, can really help with the live birth outcome. So at the end of the day, that's what people are looking at, is bringing home a healthy baby. So these are some of the reasons. So I mean, I think acupuncture is such a beautiful area to work in, because when people, when they finish an acupuncture session, they kind of usually come out feeling a lot more relaxed and a lot different to how they walked in. So for us, it's very, very rewarding, and to help people. So I think that's basically it. Today I just really wanted to talk you through a bit of the research and also like a little bit of the history of Chinese medicine and how it might help people conceive, because I'm not sure if this is something we've talked about enough. Anyway, I hope it's helpful, and please ask questions, get stuck into the comments if you have any queries or concerns. And we are going to be back next Monday at 12 o'clock. And next Monday, I'm going to be talking all things Jing. And Jing is all about Chinese medicine concepts. A bit more Chinese medicine today. It's very kind of looking at the research and whether you should do it. It's a bit more kind of Chinese medicine, talking about the Chinese medicine concepts of fertility and how we can improve our fertility. So we're going to be talking all about Jing. And what that is, and how knowing what it is can help you improve your fertility. So I hope everyone has a beautiful week, and if you're in Sydney, you're enjoying some beautiful weather. And hi Lisa, sorry, I'm just reading the comments now. And yeah, Liz, I'm glad you liked the info on the low level light laser. Oh, I've got it all back to front, but yeah, the laser therapy is pretty awesome, and I think there's going to be a lot more research on that space. But I'm going to sign off for now. Yeah, please get in touch if you've got any questions, queries, or you want any more information, and we'll see you next Monday for the next Making It on Monday. Have a great week, everyone. Thank you. Bye.